Mercury-containing silver-colored fillings are simply referred to as amalgam fillings. 50% of every amalgam filling is made of mercury, a very toxic metal. Mercury existing outside the mouth is considered a hazardous material. According to the Environmental Protection Agency and the American Dental Association, a dentist is not supposed to toss mercury in a garbage can, flush it down a drain or toilet, or dispose of it in a landfill because mercury creates an environmental hazard. Interestingly, when mercury is placed in a tooth inside your mouth or your child's mouth, it is not considered a hazardous material. Mercury is universally accepted to be an extremely toxic substance in the environment and in any patient's mouth. Mercury causes neurological damage to the brain, causes cell membrane to become leaky, which inhibits key enzymes your body needs for energy production and removal of toxins, causes oxidative processes in your tissues, leading to inflammation and possible cancers, causes immunological and endocrinological problems, hampers the body's ability to detoxify itself, and can lead to chronic illnesses such as Alzheimer's disease and Parkinson's disease. Can you get sick from just one mercury filling? Absolutely. Mercury vapor released by chewing, brushing, and grinding is the form of mercury most easily absorbed by your body. Mercury vapor goes from your mouth to your lungs and then to your brain via the bloodstream. Recent studies examine the effects of various toxic heavy metals on your brain, including aluminum, lead, arsenic, cadmium, and mercury, reveal that mercury is by far the most toxic. This is due to mercury's direct toxicity to all cells in the body, especially to brain cells. The number one source of mercury pollution is coal-fired power plants. The second position is held by dental practices due to amalgam fillings, which are 50% mercury. The World Health Organization recommends the phasing out of dental amalgam by 2018 in order to protect people and the environment from continued devastating harm. Sweden, Denmark, and Finland have been mercury-free since 2008. The New York College of Dentistry is now going amalgam-free. So with all of this in mind, the question arises, what is holding this primitive practice in place? It is difficult for any holistic-minded practitioner or patient to understand why the practice of using mercury-containing fillings, which originated in the mid-19th century, a pre-Civil War practice, continues to be done in the 21st century. This happens even though much safer, functional, effective, affordable, and tooth color compatible materials have been and continue to be available. Before you choose to allow any mercury in your teeth or the teeth of your children, I encourage you to investigate this matter for yourself. Scientific research clearly identifies the consequence of chronic, low-level mercury poisoning that comes from mercury amalgam fillings. I highly recommend that you, your family, and your friends read my book and become aware of your dental choices. Well-educated choices may result in health rather than disease, longevity instead of premature death. May you continue to watch, listen, learn, and be empowered. Join me in waking up our nation in search for health and true freedom. Thanks.